Ingrown hairs. Ugh. We've all been there, right? Those frustrating, sometimes really painful little bumps that just ruin perfectly smooth skin.
Absolutely. That feeling like your own skin is rebelling against you.
Exactly. It's such a common thing. You are definitely not alone if you're dealing with this. So today we're going deep. We're diving into your sources to, really get to the bottom of these irritations.
The biological mystery, as you put it.
Yeah. And the mission, kick those pesky ingrowns to the curb. We want to arm you with the info you need to actually prevent them.
And it is possible. That's the good news. While it's a super common problem, the irritation, the discomfort, it's familiar to so many.
Right.
But honestly, with the right strategy, thinking about exfoliation, maybe some targeted serums, the right oils, smooth, clear skin, it's genuinely achievable.
Okay, let's unpack this then. We all know the frustration, but what is actually happening under the skin? What's the real process?
So basically an ingrown hair is just, well, it's a hair that decides to grow back into the skin instead of up and out.
Curls back on itself.
Exactly. And this usually happens after you've removed hair shaving, waxing, tweezing, you name it.
And where do they typically pop up?
Oh, the usual suspects.
Yeah.
Face, neck, underarms, legs, definitely the pubic area, even the buttocks sometimes.
Okay.
And what's really key here is that if you have coarse or curly hair, you're naturally more prone to them. It's because of the way the hair follicle is structured.
Right. That makes sense. And when one does show up, what are we actually seeing? What are the symptoms?
Typically, you'll get these red, kind of swollen bumps. They might be itchy. They can look a bit like pimples, sometimes even like tiny blisters.
Filled with pus sometimes.
Yeah, sometimes pus filled. And the area can feel pretty tender, maybe even painful.
Ouch.
And occasionally you can actually see the little trapped hair under the surface. It's important to deal with them because if you don't, you risk, darker spots afterwards, infection, or even scarring.
So understanding them is really the first step.
Definitely.
Yeah.
And what's fascinating, why they happen. It's sort of a combination of things. Hair removal is a big trigger, obviously. But that natural curl in coarse or curly hair, that's a major factor. It just encourages the hair to bend back into the skin, and that starts the inflammation.
So it's not always something you did wrong during shaving, for instance?
Not necessarily. I mean, technique matters. Shaving too close or going against the grain can make it worse. But other things contribute too, like tight clothes rubbing against the skin can physically push hairs back down.
Ah, friction.
Exactly.
Yeah.
And then there's even a genetic side to it for some people. Their skin might just be more likely to react that way.
Wow, okay.
And when that hair goes back under, your body basically sees it as a foreign object, like a splinter. So it mounts an immune response, inflammation, redness, maybe infection sets in.
Okay, that paints a clearer picture. Now, this is where I think it gets really interesting. Your sources talk a lot about specific oils and serums. How do those actually help fight this?
Yeah, this is the proactive part. Products like specific ingrown hair oils or serums can be really effective. The key is their formulation.
Meaning the ingredients.
Right, they need to have ingredients that soothe the skin, fight bacteria, and gently exfoliate. Basically, they create the right environment for hair to grow out properly, not curl back in.
Okay, so let's get specific. The sources mention things like grapeseed oil, jojoba oil, lemon peel, tea tree oil. What's the deal with those?
Okay, so grapeseed and jojoba oils, those are great because they're lightweight moisturizers. They don't clog pores, which is crucial,
And
right?
non-comedogenic.
Exactly. They soften the skin and the hair itself.
Yeah.
Softer hair is less likely to sharply pierce the skin when it grows back. It makes it easier for it to just emerge properly.
Okay, makes sense. And lemon peel oil.
That one offers gentle exfoliation. It helps kind of clear away dead skin cells from the surface and around the follicle opening. Plus, it has a brightening effect, which can help with those dark spots that sometimes linger after an ingrown hair.
Post-inflammatory hyperpigmentation, yeah.
That's the one. And then tea tree oil, probably the most well-known of the bunch for this.
Right, antibacterial.
Yeah, strongly antimicrobial and anti-inflammatory. So it calms down that redness and irritation, and it helps prevent things from getting infected if the skin barrier is compromised. Using these kinds of oils regularly can really support smoother skin over time.
Okay, so oils are about softening, soothing, maybe some gentle exfoliation. What about the serums? The sources mention repairing serums. How are they different?
Serums often take a slightly more active approach. particularly with exfoliation.
Okay.
They frequently contain chemical exfoliants like salicylic acid, that's a beta-hydroxy acid, or BHA and glycolic acid, and alpha-hydroxy acid, or AHA.
Right, the acids.
Yeah. These work deeper down to really dissolve the bonds holding dead skin cells together, keeping those follicles clear. It's really vital for preventing the hair from getting trapped in the first place.
So more potent exfoliation than, say, lemon peel oil.
Generally, yes.
Yeah.
But they don't just exfoliate. Good serums will also pack in soothing ingredients, things like aloe vera, willow bark extract, which actually naturally contains salicylates and chrysanthemum.
Oh, interesting. Willow bark.
Yeah. And often they're combined with anti-inflammatory powerhouses.
Yeah.
Like niacinamide, that's vitamin B3.
Love niacinamide.
It's great. And panthenol,
Yeah.
which is provitamin B5. So you get this combination: exfoliation to clear the path, and soothing, calming ingredients to reduce redness and discomfort. They work together.
That sounds like a really comprehensive approach.
It can be. But, connecting this back to the bigger picture, the sources are careful to point out something important.
Okay, what's that?
While dermatologists often recommend these ingredients, and many people find them helpful, individual results really do vary.
Ah, right.
Yeah.
Not a magic bullet for everyone.
Exactly. And the sources also mention that, technically, more large-scale clinical research is needed to definitively, prove how effective they are across the board.
So manage expectations.
Right. And it also raises a key point. If you have really persistent or severe ingrown hairs, or things seem infected, you should definitely consult a doctor or dermatologist. Don't just rely on over-the-counter stuff.
Good advice.
Yeah.
Okay, so we've got the science, we've got the ingredients. What does this actually mean for you, the listener, in your routine? Let's translate this into practical steps. Your sources listed 5 key tips.
Absolutely. Let's get practical. First up, exfoliate regularly.
Okay, how often?
Aim for about 2 to 3 times a week. Not every day, that can be too much.
Right.
And use something gentle. It could be a mild physical scrub, or maybe a toner or serum with those AHAs or BHAs we talked about, glycolic or salicylic acid. The goal is just to gently lift away those dead skin cells so they don't block the hair.
Got it. Tip number 1, gentle, regular exfoliation. What's next?
Second, apply soothing serums right after hair removal.
Immediately after.
Yeah, pretty quickly after you shave or wax. Look for a serum with those calming ingredients, niacinamide, panthenol, maybe willow bark or aloe.
Why right away?
Because hair removal itself causes minor inflammation and sometimes swelling around the follicle. Applying a soothing serum quickly helps calm that down before it has a chance to trap the emerging hair. It's preventative.
Smart. Okay, tip 2, soothe immediately post-removal. What's 3?
Third, and this is so basic but so important, keep your skin hydrated with lightweight oils.
Daily.
Yep, daily moisturizing. Use those non-comedogenic oils. Jojoba, grapeseed, rosehip is another good one. You want moisture, but you don't want to clog pores.
And how does hydration help specifically with ingrowns?
Hydrated skin is softer, more supple, more pliable. When skin is dry and tight, it's harder for the hair to push through easily. Soft, hydrated skin makes it much easier for the hair to grow straight out.
Okay, hydration is key. Tip 3 done. Number 4.
Fourth, use targeted ingrown hair serums consistently.
So this is different from the post-shave soothing serum.
It can be the same one if it has the right ingredients, or it could be a separate treatment serum. The point is consistent use, especially on areas where you know you're prone to ingrowns.
Like the bikini line, underarms. Yeah.
Exactly. Beard area for men. Use a serum with salicylic acid, glycolic acid, or maybe tea tree oil regularly on those spots, even on days you don't remove hair. Consistency helps keep those follicles clear over the long term.
Right, it's maintenance. Okay, consistency with targeted serums. And the last tip.
Finally, number 5, and honestly, this might be the most crucial. Don't overdo it. Be gentle.
Ah, the less is more approach.
Totally. It's so tempting to scrub really hard or pile on strong products when you're frustrated. But aggressive scrubbing or overusing active ingredients, that can actually irritate the skin more.
Making the problem worse.
Precisely. Irritated, inflamed skin is actually more prone to trapping hairs. So stick to your gentle, consistent routine. Pay attention to how your skin feels. If it's getting red or irritated, back off a bit.
Listen to your skin. Okay, that's a great final point. Be gentle.
It really is key.
So quite a journey we've taken here from, understanding what these little rebels actually are, biologically speaking, to figuring out why they show up, and now having a real arsenal of ingredients and practical tips.
Oils, serums, exfoliation, hydration, gentleness, it all fits together.
It really does. And as you think about maybe trying some of these gentler, more consistent approaches, here's something to maybe ponder for yourself.
Okay.
Perhaps the best skincare, especially for sensitive issues like ingrowns, isn't always about harsh treatments or quick fixes. Maybe it's more about that consistent, gentle nurturing, allowing your body's own processes to work optimally. So the question for you is, what subtle signs is your skin giving you that it might need a bit more gentle, intuitive care?